All right, let's get right into it. The most common trauma emergency that you're going to encounter are very simple wounds and bleeding. Now, it's important for two things to happen when we talk about wounds and bleeding. One, how much blood are we talking about? And two, how much are we expecting to talk about? You have plenty of blood. By plenty, it doesn't really matter if that's a good term or a bad term. That is a very unquantitative term. You have around 8 pints, 4 quarts, 1 gallon, so 1 milk jug full of blood in your body as a normal adult. Now, sometimes that's more if you're bigger or if you're pregnant. Sometimes that is a little less for a multitude of reasons. But when you start to lose blood or have a traumatic incident, your body is very, very smart. And it will actually shut down things you don't need right away in order to keep the majority of your blood in the areas and organs that you do need right away. So what's the largest organ of your body? Notice I said of your body, not in your body, because the largest organ as far as blood supply goes is your skin. And so it's pretty common when someone starts to have a traumatic emergency or a medical emergency that the blood goes to the core of the body where it's needed most and shunts away from the skin. So someone's going to potentially look more pale, they're gonna feel cool and clammy. So those are some telltale signs. Maybe they'll start to lose feeling or get numbness in their fingers, in their toes. They'll get dizzy, lightheaded, ringing in the ears, blacking out vision. Some of you are having flashbacks to when this happened to you last because you remember it well, right? So whatever the reason is, your body is going into a systematic shutdown. Now, in medicine, we have a name for that systematic shutdown, and that is going into shock. Or in medicine, we would simply call it hypoperfusion. Fancy Latin way of saying very little blood flow. So it's going to hypoperfusion or shock is your body systematically shutting down on purpose, as it should. It's not a bad thing, it's a good thing, so that it can save your life. And it's going to push blood to the core of your body. So when that happens, let's say you get a cut on your arm, it would be extremely rare to go into an extreme blood loss situation unless it was a major artery. And we're going to talk about major arteries in a little bit, but almost all bleeding, we can get stopped. In fact, it would stop on its own if you were to just leave it. But if you want to make it look a little less gory and help them feel better about it, there's some things we can do to slow and stop that bleeding before we get to an extreme situation. So let's talk real quick about the 4 components of your blood, because one of those is the key to getting bleeding to stop. So first of all, there's many types of injuries that can cause bleeding. Bleeding we can see can be stopped by getting it to clot, right? Or what we call coagulate. It sticks together. That's great. There's only one part of the blood that does that, and I just said what it was. So platelets are the part of the blood that stick together to help it to clot, and we get platelets to work or stick together by getting them to slow down. It doesn't matter what first aid you've taken in the past or what you know about the human body or what kind of emergencies you've dealt with in the past. All bleeding stops by getting the platelets to work. And the platelets work by getting them to slow down. Now, there's some keys to getting the platelets to slow down. One is to get the person's heart rate to slow down. That's what's dictating the speed of blood in the first place. So there are a few ways you can get a person's heart rate to slow down. The human body will get your heart rate to slow down by making you pass out. Then you can't think about it and your heart rate will slow down. That'll help you stop bleeding. But we don't want people to pass out. So we're gonna help them calm down. We're certainly not gonna make a big deal of their blood. We're not gonna look at the injury. We're not gonna say, oh my goodness, that's the worst thing I've ever seen. Oh, I think I can see the bone in there. We're not doing any of that stuff. We're not talking about it. We're not going to a washroom or restroom where they can look in the mirror and see it pouring down their face. We're not gonna let them look at it if we can help it. So we're gonna hold it up, away, out of the way, right? So they can't see what's going on. We're gonna distract them. We're gonna talk about other things, right? If we can, without looking like an idiot. So we're gonna talk to them about other things that happened. What were you doing at the time? Is there anyone we can call for you? Let's just see how this is before we call for help, right? Things like that. So we can talk about things other than what we're physically seeing to help them relax and slow their heart rate down. So we have rest. Rest. Get their heart rate down. Do not panic. Do not go on a frenzy looking for a first aid kit, tearing things out of the cupboards and, oh my goodness, where's the first aid kit when you need one? We're not doing any of that. We don't, well, first aid kit's awesome, but we can do things without a first aid kit too, and someone can go get it and we can get it later on. For right now, calm down. This is not the first time someone's had a bleeding emergency, and they will probably be fine if we just stay calm. Then another good way of getting the platelets to slow down is to elevate the injury. So if I have a cut to my hand or my arm, I'm going to get myself calm, or someone else is going to calm me down, or I'm going to calm someone else down if they have an injury to their arm, and we are going to elevate it. We are going to lift it above the level of their heart. Heart's here, injury's here. That's going to help slow down the platelets, and then they're going to stick. And of course, we do this in conjunction with D, direct pressure. Direct pressure on it is great. If it's their own injury and they put their own hand on it, that's okay. If it's you treating someone else, we should have a barrier between us and them. Gloves in a first aid kit are great. If you don't have gloves handy, we can use a plastic bag, we can use a piece of clothing, as much of a barrier as we can. And of course, something that's going to keep the blood from moving quickly is great too. So gauze, bandages, paper towel, toilet paper, things that are going to get that blood to stick and not move so much are going to help it to clot. And if you are using bandages on it, when you go to cheat and look at it, don't pull it off. Don't pull it off. If you pull it off to see if it's bleeding, it'll start bleeding. So just keep it in place. If you're keeping a bandage in place and you have rest, elevation, direct pressure, as you can see behind me, our red principle, rest, elevation, direct pressure is going to stop almost all bleeding. And we'll talk about what to do if it isn't. But how do you know if it's still bleeding? Look at it. Is there blood pouring out? Is the red dot in your gauze or paper towel getting bigger? If it's not, it's stopped bleeding. By the way, it would take an extreme amount to lose the amount of blood you would need to have a real serious problem from bleeding. Most bleeding emergencies lose, whatever, a teaspoon or two. Remember, you had 8 pints. You can lose 7 of those and survive. So that is an extraordinary amount of blood. If I were to be walking around with a water bottle full of my own blood, first of all, that'd be crazy. Second, you would think that is an awful lot of blood, right? That is a huge amount. No, it's not. It's only 1/8. They take it out when they take your blood, right? And then they let you drive home in a huge semi-truck. So it can't be that bad for you. There's no one following you to make sure you don't go fly a plane after you give blood. So it's okay. You have lots of blood. There's lots of blood in your body. Your body will shut down systematically. You're going to stop the rest and the craziness. So we're going to get them to calm down, elevate the injury, direct pressure on the wound. If it is bleeding more, or it is a significant amount of blood, obviously we're going to call 911, get some help on the way, but there are some other things we can do as well. So let me just rip through some slides. We can see that rest, elevation, direct process in order, and then we can talk about what to do in the case that it doesn't work. So we're just going to, hopefully you can hear me still. We're going to get into applying fingertip pressure. So that's the direct pressure part. We're keeping them at rest as well, elevating it above their heart. If we need to add more, we add more gauze. We don't peel off the original ones. We just keep going over top unless it is creating literally a massive pile of gauze. Then you can take most off, but keep the original ones in place. If pressure does not work to stop the bleeding, we are actually going to go to pressure points. So I'm just really quickly going to talk about pressure points. It would be slowing down the flow of blood to that site of the injury by putting pressure on the pipe leading to that place. So if I've cut my forearm on my left hand, I can push on my brachial artery that is just inside under my bicep. So from the bottom up, then push in on the bone. So you can try this on yourself or someone next to you, maybe not someone next to you for socially isolating, but you can try this on yourself. Push under your bicep, in on the bone. Now push on it. Go ahead, push hard. You're gonna very quickly feel kind of a thumping, a pulse, if you will. That's your brachial pulse. That is your brachial artery in there. And after a little bit, your hand's gonna get a little numb and tingly. That's because you're slowing down the flow of blood to your arm. So brachial artery, both sides of your body. The femoral artery is for your lower limbs. So if you have an injury to your left leg, on the left side of your groin, kind of right in the middle, between the middle, the center of your body, and your outside of your hip, right in that natural crease of the leg, if you were to put pressure there, now again, pick the side that the injury's on, because you have two sets of femoral arteries, one down each side. So if it's the left leg that's injured, push on the left side. If it's the right leg that's injured, push on the right side. But if you put pressure on that femoral artery, it's gonna slow down a lot of blood flow. And again, keep it elevated. So they're laying down, leg is up, pushing on the femoral artery, pressure on the wound. All those things are going to help slow down the flow of blood. So we won't practice this on each other today, COVID or not. We'll just leave the femoral artery for another time. So you can just push on that spot, halfway between the outside and middle of the pelvis, right in the natural crease of your leg. Brachial artery is the upper arm, right against the inside of your arm, under the bicep, push against the bone. You can try and find those and do that. There is an indirect pressure point for your head. That would be your carotid arteries. We do not push on those ever, because that's going to limit blood supply to the brain as well. So if you do have a head injury, same thing. Elevation above level of heart, so sitting or leaning up, pressure on it, try and get them to calm down, call 911. Other signs of a significant head injury, though, if someone does have bleeding to their head, would be, is it worse than just the skin and a little bit of muscle tissue that's underneath it? Is it actually caused damage inside the skull? Because you can actually bleed inside your skull and it'll actually put pressure down on the brain because it can't go up. So if it's the goose egg bump, that's up, that's outside the skull. But inside the skull, it can't go up, so it goes down. And if you start to put pressure on your brain, depending what part of the brain that is, you're going to start to see some unique signs and symptoms. So people that are disoriented, don't know who they are, don't know where they are, have unequal pupils, one's big, one's tiny, that's a bad sign. If they have bleeding from their ears or their nose, right? If I got hit in the nose and I'm having a nosebleed, that makes sense. If I get hit on the top of the head and have a nosebleed, we need to have some internal bleeding that we need to address that's pushing down on the brain and basically coming out my nose, right? The base of my skull. So we need to get some help. If you see any of those signs of significant head injury, and I'll pull the slide up right away here, then we need to get help. So difficulty with vision, headaches, unequal or unreactive pupils, and of course bleeding or fluid from the ears or nose. If anyone has a serious head injury, we should also suspect that they could have a serious neck injury as well. That's the weakest link in the chain, and we want to make sure we get them help for that by moving them as little as possible while we're waiting for EMS or the ambulance to arrive. In that case, we're supporting their head, we're supporting their neck, we're not moving them around, we're not rolling them unless we have to, unless the scene's unsafe to do so. But just keep their head and neck still, support it, get help there. The EMS providers are going to know exactly what to do and stabilize that head and neck, get them on a board and get them into the hospital as soon as possible to check everything out. So as far as trauma, we talked about wounds, bleeding, and head injuries. Keep that in mind. You can practice that sometime on your own or just think about that. Next, we're going to get into some other trauma, things like burns and other injuries. So we'll see you in a minute.